Hello students, today we are going to be starting the first video of our GIT Gross Anatomy series, which starts with stomach. So this video is about stomach gross anatomy. So let's get started. First of all, what is stomach? Stomach is basically a dilated portion of the alimentary canal and it is J-shaped. Okay, what is stomach? Stomach is a dilated portion of our alimentary canal, which is the gastrointestinal tract, and the stomach is J-shaped. So what are the functions of our stomach? The main functions of our stomach involve the storage of food, which is about 1500 ml. The second function is mixing food with the gastric secretions. The food enters the esophagus as bolus, and then when it reaches the stomach and mixes with the gastric secretions, it forms the chyme. Okay, so the third function of our stomach is the digestion of food, which involves carbohydrates, protein and fat digestion. Okay, so what is the location of our stomach? Where is it present in our human body? So the stomach, it is obliquely present. Obliquely meaning it is not in a straight line, it is curved at an angle. So basically it is obliquely arranged in our abdomen. And what are the regions of the abdomen which it has taken over? There are three regions, which is the epigastric region, the umbilical region and the left hypochondriac region. This region on the above the umbilical region is the epigastric region, and the region left of the epigastric region is the left hypochondriac region. So the umbilical region, the epigastric region and the left hypochondriac regions are the areas where the stomach is located. The third point is left costal cartilage and the ribs are placed anteriorly. The costal cartilage of the ribs and the ribs themselves, they are placed anterior to the stomach. So what's the shape of the stomach? Normally when the stomach is empty, the stomach is J-shaped, but when it is filled with food or chyme, it forms a shape called piriform shape, which is pear-shaped. Okay, so how do we know the shape of a stomach of a living person, like when the stomach is filled and when it is empty? We use a method, a radiograph method, and it involves giving the patient a barium rich meal. So when we do the radiograph, we see that the shape of a stomach is either J-shaped or piriform shaped, meaning pear-shaped. So I have given a diagram in which the parts of a stomach are given clearly. So this is the esophagus and these are the parts of a stomach. The stomach parts include the fundus of the stomach, which is the upper dilated portion, and then the body of the stomach, which occupies the major portion, the antrum and the pylorus region. Okay, the pyloric sphincter is present here before the duodenum. We have two orifices or openings of the stomach. They are the cardiac orifice and the pyloric orifice. The cardiac orifice has a sphincter known as the cardiac sphincter, and it is present in the cardiac orifice region. The pyloric sphincter, it is present at the region of the pyloric orifice, in the pyloric region. So now we're going to be studying the structure of the stomach. The stomach has four main parts. Okay, so the first part is the fundus. The fundus, it's dome shaped. I showed you in the diagram. This is the fundus. Okay, it is dome shaped, and it projects upwards. It is projected upwards. Then it is present on the left of the cardiac orifice. The cardiac orifice I showed you. It is the fundus is present on the left of the cardiac orifice. This is the cardiac orifice, and this is the fundus. The fundus is placed left to the cardiac orifice. So why is it dilated? It is because of the gas which is filled inside it. Okay. Now we come to the body of the stomach. The body of the stomach is from the cardiac orifice to the incisura angularis. Incisura angularis, it is an important landmark on the lesser curvature. Okay. The incisura angularis it is a constant notch on the lesser curvature, and it is a very important landmark. So the third part is the pyloric part. It is mostly the tubular part of the stomach, and it contains a pyloric sphincter, which is a thick muscular wall. Okay, and it has a pyloric canal, which is the cavity of the pylorus. Okay, the dilated portion, the cavity of the pylorus, is the pyloric canal. Now what is pyloric antrum? Pyloric antrum is the region between the incisura angularis and the pylorus. So I show you in the diagram. This is the incisura angularis, and basically the antrum is the region between the incisura angularis and the pyloric region. Okay, what are the curvatures of the stomach? The stomach has two curvatures, the lesser curvature and the greater curvature. The lesser curvature I'll show you in the diagram. This region is the lesser curvature, and this one is the greater curvature of our stomach. So we'll give details about it. The lesser curvature is present on the right border of the stomach. It is between the cardiac orifice and the pylorus, and it is connected to the liver by the lesser omentum. Okay, the lesser omentum, it is attached to the lesser curvature and it goes till the liver. Okay, what is greater curvature? The greater curvature is covering the entire left border of our stomach, and it has a gastrosplenic ligament and a greater omentum. We'll talk about its detail further. The interior and exterior walls are made up of mucous membrane, muscular wall, and a peritoneum. These two, the mucous membrane and the muscular wall, are the interior regions of the stomach, and the peritoneum is forms the exterior wall of the stomach. So the mucous membrane, it is thick and vascular. It is thick and vascular inside the stomach, and it has numerous longitudinal folds which are called as ryugi. Okay, ryugi are the folds which are numerous in number, and they are longitudinal. So the muscular wall, it is made up of three smooth muscle fibers, basically the inner oblique fibers, the middle circular fibers, and the outer longitudinal fibers. Okay, the peritoneum, now we come to the peritoneum. The peritoneum surrounds the stomach. It forms the lesser omentum, the greater omentum, and the gastrosplenic omentum. So what are the relations of the stomach? Relations of the stomach include anterior and posterior relations. The anterior relations we can know by name, that is stomach, what is present in front of it. The things that are present in front are the anterior abdominal wall, the left costal margin, because you know the stomach is on the left side of the abdomen. So the left costal margin, the left lung and pleura, obviously because they are present beneath the costal cartilage. So the left lung and the pleura are present beneath the costal cartilage and in front of the anterior portion of the stomach. Then comes the diaphragm, the left lobe of the liver. You know the liver is the largest organ of our body. Now comes the posterior relations of the stomach. The posterior surface, also called the stomach bed, has several relations which include the lesser sac, which is also called the omental bursa, the diaphragm, the spleen, the left suprarenal gland, the upper part of the left kidney, obviously because the suprarenal gland is present on the upper pole of the kidney. So then the splenic artery, the pancreas, and the transverse mesocolon, the transverse colon. Okay, you know the stomach is present above the pancreas. So the pancreas are a great part of the pancreas is on the posterior surface of the stomach. Now coming to the blood supply of the stomach. It involves several arteries and veins. Okay, first we are talking about the arterial supply. The arterial supply starts from the celiac artery. Okay, this is the celiac artery. It releases three branches. The first branch forms the left gastric artery. Okay, the first branch of the celiac artery is the left gastric artery, which supplies a part of esophagus and the upper portion of the lesser curvature. Then comes the splenic artery. The splenic artery travels all the way behind on the posterior surface of the stomach and goes till the spleen, and it releases many branches like the short gastric arteries which supply the fundus of the stomach, and the other branches include the left gastroepiploic artery, which supply the a major part of greater curvature, and then the splenic artery is drained into the spleen. Okay, so the third artery from the celiac trunk is called the common hepatic artery, and it divides into two branches. The first branch it goes to the liver, so it is called the proper hepatic artery, and the proper hepatic artery, it gives a branch which is called the right gastric artery, which also supplies the inferior part of the lesser curvature. Okay, the other branch of the common hepatic artery was the gastroduodenal artery. It further divides into the superior pancreatic duodenal arteries, which further give the arterial supply to the pancreas and the duodenum, and the second branch was the right gastroepiploic artery, which also gives its arterial supply to a major portion of the greater curvature. So this was about the arterial supply of our stomach. Now I have given it in the form of a flow chart. The celiac trunk, it is divided into left gastric artery, the common hepatic artery, and the splenic artery. The left gastric artery is supplying the lesser curvature and the esophagus. The common hepatic artery, it is divided into two branches: the proper hepatic artery and the gastroduodenal artery. The proper hepatic artery, it gives it gives a branch called the right gastric artery, which also supplies the lesser curvature. And then the gastroduodenal artery, it gives a branch called the right gastroepiploic artery. So, I've shown in the diagram that it supplies the lower portion of the greater curvature. Okay, then the splenic artery, it divides into two branches. The first branch is the short gastric arteries, which supply the fundus, and the left gastroepiploic artery, which also supplies the greater curvature. Okay, the major portion of the greater curvature. Now we have the venous drainage. The venous drainage is very simple, and mainly the veins, they are drained into the portal circulation. We have mainly divided the venous drainage into three portions. The right and left gastric veins, which supply the lesser curvature, are further drained into the portal vein, directly into the portal vein. The short gastric veins and the left gastroepiploic vein is drained into the splenic vein. And the right gastroepiploic vein is drained into the superior mesenteric vein, and this is an important multiple choice question. So now we have the lymphatic drainage. The lymphatic drainage is divided into three nodes. The three nodes include the right and left gastric nodes, the right and left gastroepiploic nodes, and the short gastric nodes, which further drain into the celiac nodes. Now we have the nerve supply. The nerve supply is divided into sympathetic and a parasympathetic nerve supply. The sympathetic innervation of our stomach is through the celiac plexus, and the parasympathetic innervation of our stomach is through the vagus nerves. Thank you for your attention.